After being botched, I expected my initial surgeon to go above and beyond to correct the situation. I was told that if I wanted a revision, I would have to pay out of pocket because the job was, according to her, properly done, and that I am, quote unquote, having body dysmorphia. I paid out of pocket for the cosmetic portion of this procedure and never expected to end up like this. That being said, this needs to be fixed. I had a consultation with a wonderful surgeon who people I know have gone to, who is reputable and has wonderful reviews. He told me that all of this is going to have to be done over from the beginning and completely revised. My new procedure is scheduled for June and will cost over $16,000.
This is an oil cyst. This is a seroma. This is a lipoburn. This is fat necrosis. Watch this video. I'm going to go into detail and talk about all of the complications from a BBL.
Hi, it's Dr. William. So let me first establish what we as surgeons mean by complications. I think it's a little bit different between how patients view complications and how surgeons view complications. So sometimes patients' families will ask me, were there any complications during the surgery? It implies that there's something that went wrong during the surgery, that something was cut that shouldn't have been cut. But doctors view complications something completely different. We view complications that things that could potentially go wrong with a surgery, even though we're doing everything correctly. And so this kind of is similar to if you imagine driving a car. If you're driving a car, you're wearing your seatbelt, you're following the speed limit, your car's in good shape, everything's fine, and you can have a flat tire. And so that's really how we view complications. The way patients view complications, or families, was there a complication? I think they're really referring to more like medical malpractice, something that was done incorrectly. Whereas complications are really things that just naturally happen. Part of having surgery, operating on humans, is that things can develop that turn into a problem. Not because something was done incorrectly, it's just because if you do enough patients and you have enough surgery, you're going to have patients that have these problems. And I'm going to kind of start with the more minor ones and more common ones and work our way down to the ones that are more dangerous or potentially fatal and are more rare. The first complication, seroma. So what is a seroma? This is something we see in, probably about 1.5%, 2% of patients can develop a seroma after surgery. So a seroma is just a fluid collection that happens underneath the fat, in between your muscle and the fat after having a BBL. And what typically happens with your body is that your body has arteries and veins, and the blood flows around and it gets transmitted from the artery to the tissue, and then your body brings that blood back through the veins, and that's how you have a general circulation and a distribution of all of the nutrients and oxygen to your body. That's how your body works. There's another area of fluid that also functions, and that's called lymphatics. And that's a little bit more of a nebulous kind of circulation. It's not exactly like the artery and the vein, which are very clear cut. And the lymphatics are really tiny little, almost invisible channels that take some of the general fluid back to your heart. And that lymphatic fluid is what can cause a seroma. When you do liposuction, you're going to disrupt those lymphatic channels, the little bridges, if you will, that bring that fluid back. They're going to be broken just because of the force of the cannula doing, the back and forth of the liposuction. So those little tunnels or bridges, they get broken, and the fluid will accumulate because there's nothing to take that fluid back to the heart. And so what we do is I leave all the incisions open after liposuction, and during the first 48 hours, sometimes 72 hours, the massage therapist will work all of that lymphatic fluid out of your body. And you've seen the videos on YouTube and Instagram with this, lot of fluid coming out. And we want that to happen because we want that lymphatic fluid to get out of the body because there's no way for it to get back up to the heart. If those lymphatic fluid does accumulate despite all the massages, there's lots of different reasons: inadequate compression, if the faja is not worn properly, there's not pads or boards, or the massages aren't done, or even if all of those things are done perfectly correctly, you can still have a seroma. It's just a little area of fluid. It's not the end of the world. There's nothing that's harmful about it, but it has to be taken care of. And usually what I do is I'll take a little needle and a syringe and I'll insert it through the skin. It doesn't really hurt. The skin's usually still a little bit numb from the liposuction. And then I'll remove that fluid. And usually that's sufficient, that's enough, and that seroma will be treated and then back in the faja, and the fluid doesn't come back. Once in a while the fluid will come back and we'll have to do that again. But that's really the most common complication after a BBL, and that's called a seroma. Something else that can happen after any surgery at all is infection. And again, it's not really that something was done incorrectly, that somebody, spat in the wound or something. It's just something that will happen because we're working in an environment, your body, that's covered with bacteria. And despite giving preoperative antibiotics when you go to sleep through the IV, despite cleaning the skin with, HibaCleanse, despite sterile instruments, sterile gloves, gowns, sterile technique, all of these things, still you can develop an infection. It's not common. It happens in less than 1 or maybe 1% of patients. It's usually very treatable with antibiotics, and there's usually no long-term problems with it. There's kind of two places where you can have an infection. One is in the skin. We call this a cellulitis, and that's where there's a little break in the skin because of the liposuction, and the bacteria can get underneath the skin and they camp out in the skin. The skin gets red, hot, firm, tender, and swollen. And so that's treated with antibiotics, and it usually resolves by itself. We usually don't have to admit the patient to the hospital, but just give antibiotics orally by mouth, and that infection will go away. When you talk about a BBL, it's actually usually caused by a bacteria called E. coli, which is not very common typically in skin. Normally we see a staphylococcal infection, which is more related to the bacteria on the skin. But because of BBL, we're working around the anus, there's E. coli, which is a more common contaminant there. And again, despite cleaning, we put a lap pad with some betadine and things like that in there, it still can happen. So that is the most common type of infection afterwards, and that's treated with antibiotics. Again, it's not a common. 99% of people are likely to be without any infection, but if you're operating on enough patients in your career, you will have patients with infection, and I certainly have had patients with infection. The most important thing is to recognize it early, diagnose it, and then treat it appropriately and follow the patient so that we get resolution of that infection. Rarely, and I have not had this very commonly, you can have an infection that becomes a little bit deeper. And that's not a cellulitis, that's not just in the skin, but that's a little bit deeper, and that's called an abscess. Now, an abscess is just a collection of bacteria and your body's white blood cells. That's what pus is. It's bacteria mixed with your white blood cells, because your white blood cells are those cells that are kind of the defenders of your body, and they're fighting that infection. And so if you get an abscess, it shows itself very much like a cellulitis in that it's red, warm, tender, it hurts. But an abscess also can make you feel a little bit bad. It can give you a higher fever. Anything over a temperature of 101.5 is what we consider a fever. And you can have swelling, or you can have an area which we call fluctuance, which is just like a little bogginess there. It's a little, you can feel that there's some fluid in there, and it hurts when you do that. So that's an abscess. That you cannot treat just with antibiotics alone. That you actually have to treat just like you would a boil. So you make an incision over the area where it's really boggy, and that pus comes out, and then you leave the wound open and you pack it with gauze. You take showers, you wash with soap and water, and you let your body heal from the inside out. Sometimes you don't even need to have antibiotics if it's just a straight abscess and there's no infection in the surrounding skin. But most of the time, you do need some antibiotics in addition to having the incision because there's also an infection in the skin around. Usually once you open that incision, it's fine, the pus drains out. Once you keep the incision open, everything will heal over time. So that's infection.
Please like and subscribe. For real, subscribe.